Mr. Harris, how are you, sir? What
Morning,
brought you
Forrest.
in here today?
Well, I've had a L2 assessment for more than a year, and I think one is needed, so this is why I'm here today.
Okay, and you felt that you need to have one done today, right?
Yes, sir.
Okay, so then I'm going to be the one who's going to perform the head to toe assessment. I'm one of the students from Herzing University. My name is Archie Moore, and thank you for being here. Okay, let me know something. How old are you?
60?
You're 60 years old. And tell me, any family history of
Yes.
any condition? Yes. Could you tell me what?
Both parents,
Mm-hmm.
hypertensive.
Yes.
Um, that's about it.
Okay, are they still alive?
Yes.
No, they are. Any siblings
Yes.
with any comorbidities or anything like that?
Yes.
Okay. So let me know. Tell me, what about any past medical histories for you?
Hypertension
Mm-hmm.
that I'm being treated for,
Mm-hmm.
and also during my early childhood, I had my hand broken
Mm-hmm.
and was surgically fixed.
Oh, okay, okay. All right, so let me know. Or is your vaccination up to date?
Yes.
Okay, they are. And are you taking any medication now?
Yes, I am.
Okay, could you tell me the name of the medication that you're taking?
Benacar
Mm-hmm.
and Codivolo.
Oh, how many milligrams of Benacar are you taking?
It's 40,
Okay.
10.5,
Uh-huh.
and the Benacar 10.
And the Benacar 10. Okay. Are you allergic?
The Codivolo 10.
Cardival 10?
Mm.
Okay. Are you allergic to any medication or any environmental factor?
Not to my knowledge.
Your knowledge. Okay. Let me know. Is there any social history? Yeah. Or what's your profession?
Presently, I'm a nurse.
Okay.
I'm practicing RN.
Yes. Good.
I like to party
Okay.
um,
In your spare time.
in my spare time.
I see.
And I'm a girl watcher.
Oh, I see that, Mr. Mr. David. Thank you for that information. I think we will pass that one along, right? Okay. Tell me, are you married?
Yes.
Yeah. Any children?
One.
Okay. All right. Thank you. I am going to review with you the systems. Here, the history of the illness. Mr. Harris came in today because he has not had an physical head-to-toe assessment done in the past for a long time. So he's here today to have one done. And he is 50 years old, African American. And I am going to be doing the head-to-toe assessment with Mr. Harris today. Okay, I'm going to review the systems with you. Any problem with the head? Any pain? Any headache? Any tenderness? Any dizziness?
None of them.
None of the above. Okay, tell me, what about the skin? Do you find any problems with the skin? Any nodules or
Not
any
at all.
swelling or anything like that? Okay. What about the cardiovascular system? I mean, it's
Apart
circulatory.
from hypertension,
Sure.
nothing.
Okay. How about your respiratory system, the lungs? Any asthma, any cough, any whooping cough, or any of those?
No.
No. Okay. Tell me, what about the genital system? Is it okay, working all right? Any problem?
No problem whatsoever.
Frequency, none of that.
None of
No
that.
hesitancy or none of those things,
None of
right?
that.
What about your endocrine system? Any diabetes? Any thyroid problems?
Not to my knowledge.
Not to your knowledge. How about your musculoskeletal system? You ambulate well? Any swelling?
No swelling.
No swelling?
Ambulation.
No tenderness?
No.
No joint pain?
No.
Okay. How about your hematological system? Any bruising? Any bleeding or any of those things?
No.
No. Okay. Psychological? Are you depressed?
No.
No. What about any suicidal ideation?
None of that.
Neurological? How is it? You know what day is today?
Yes.
Yes. Yeah. What month of the year?
Mm-hmm.
Yeah. You know who is our president?
Yes.
Okay. Thank you very much. Okay. So let me take a look at your head over here. Looking good. Scalp looking all right. Cheeks all right. Everything looking good. The hair and what have you. The eyebrow. I'm going to palpate your maxillary, your frontal sinuses. Any tenderness or anything here?
No.
No? What about the maxillary sinus here? Any problem?
No.
No? Okay. All right. I am going to check your blood pressure,
Mhm.
see what's going on. Blood pressure 150/84. Have you taken your medication today?
No.
Oh, you have. Let me check your temperature. Let's see. .4. Good. Check your pulse. .76. Okay, let me check it over here. Bring up your arm this way. No, put it right here. Respiration 18. Thank you, sir. Okay. Now let me take a look at your eyes. Look up for me. Look down. Okay, the irises, the cornea, looking very good. Right. The conjunctiva is very pink. Very good. Let me look in the ears. Very well. Okay. There. It's good. Okay. Use this. I can see the turbinates. The turbinates are intact. It's mucous membrane is pink and moist in that one. Okay, turbinates are okay there. Looking good. Mucous membrane is extremely pink. Thank you. Now let me look into your mouth. Open. Yeah, the roof. Fantastic. is the tongue, the floor of the, no, head down a little bit, the floor of is looking good, the tongue is looking good, the jaw is looking, everything is looking good, the lips looking very good, and also the teeth. All right, okay, so now I am going to palpate your, I want you to clinch down on your jaw. I'm going to take the temporal mandibular joint here, I'm going to check it, open the mouth for me, I palpate, okay, close really, intact, real good, okay, I'm going to check the occipital lymph node right around here, whether the sternocleidomastoid meets the occipital area here. Looking good, all right. The preauricular lymph node right, the postauricular lymph node behind the ears. It's fantastic. And the preauricular lymph nodes here. It's okay. Two. Okay, now I'm gonna raise the head. I'm gonna check the carotid here. All right. I'm gonna also check the submandibular right around the jaw, submandibular lymph node here, right underneath the length of the jaw, and the submental lymph node is right here. Okay, right around here on this side, I'm going to check the anterior cervical lymph node. It's right here. The exterior cervical lymph node is right here. And down here in the sternocleidomastoid fossa is the sternocleidomastoid lymph node, and looking fantastic. Okay, all right. All right, so let me listen to your precordia, the second right intercostal space. I'm listening to the aortic valve. Second intercostal space on the left sternal border. I'm checking the pulmonic valve. The third intercostal space in the left sternal border. I'm checking the second pulmonic valve. And down here in the left sternal border, I'm checking for the tricuspid. And the mid-clavicular line, I'm checking for the mitral valve. Okay, I use the diaphragm of my stethoscope. I'm going to use the bell of my stethoscope now to check again the second intercostal space for the aortic valve, the second intercostal space for the pulmonic valve in the left sternal border, the third intercostal space in the left sternal border is the second pulmonic valve, the third intercostal space in the left sternal border is the tricuspid, and the mid-clavicular line is the fifth intercostal space is the mitral valve. This is our first process. Listen for the aortic here. Very good. Mr. Harris, I'm going to check the cranial nerve with you, okay? I'm going to close your eyes. I'm going to pass something under your nose and you tell me what it is. Very good. Very good. Okay. All right. Cranial nerve, that is the olfactory cranial nerve 1, olfactory nerve, which has to do with smell. Okay, I'm going to do talk to you about cranial nerve number 2, which is the optic nerve, and that is to do with the eyes. Okay, the movements of the eyes, the visual activity of the eyes. Okay, so at this point, I'm going to ask you to go with me outside, and we're going to look at the chart on the door. Okay. Right here. Right here. Come down here a little bit. Good. All right. So with the hand over the right eye, yeah, can you read this line for me?
Filopzd.
Okay. All right. Swap eyes. Okay. Can you read this back way for me?
DZ P O L I Y.
Okay. What about this one with the
Your hand covering it.
yeah?
That's P Z
Mm-hmm.
O P
Mm-hmm.
D
Mm-hmm.
like F.
Okay. So all right. With the left eye is the 2030, and with the right eye 2025. Okay. All right. Come along. Come on. That was cranial nerve number 2. The optic nerve. Okay. Along with the optic nerve, I'm going to do the cover test and see how you react to light. Okay, all right. Good, very good, very good. And also, I am going to do for you the reaction to the light. I'm going to see the activity of the light, how the pupil reacts. So by doing this, good, okay, good, pinpoint, and real good. Okay. Also, I want you to take a look with an aspect of the optic nerve. I want you to take a look straight ahead and look at the tip of this, and then look at the wall. Again, look at the tip and look at the wall. Look at the tip. And that is called accommodation, okay, Mr. Harris? All right. Now I am going to check. That's what's cranial nerve number 2, cranial nerve number 3, 4, and 6, which has to do with the eye, the muscle of the eye, who supplies the eye with the muscle. So I'm going to do, I want you to look at me, and I'm going to do the H figure, and you tell me what's going on, okay? Beautiful, very reactive. Okay, that was cranial nerve 3, 4, and 5, 3, 4, and 6. Cranial nerve 7, which is the facial nerve. I am going to ask you to do 3 things for me. I want you to blink. I want you to squint. I want you to smile. I want you to show your teeth up and bottom, right? I want you to puff out those cheeks. There you go. Everything is doing good. No deviation from now. Cranial nerve number 6 I did. Cranial nerve number 7, which I had already done. And cranial nerve number 8, I want you to cover one of the ear, cover the left ear. I'm going to whisper something and cover mine in your ears. 2, 4, 5. What did I tell you?
2, 4, 5.
Okay, I want you to cover that. What did I say?
2, 4, 9.
Okay, great. So that was the cranial nerve number 8, which is the hearing and the balance nerve. Okay, cranial nerve number 9, and number 10. I want you to cranial nerve number 9 and number 10. I want you to open your mouth, okay? And I want to take a look at the jaw, and which is to check on the uvula and the gag reflex. So here we go. Okay, there you go. Lovely. All right. All right. The uvula, push your tongue out a little. Uvula looking very well. And I want you to move your tongue from side to side. That was cranial nerve number 12. Now I'm going to check for cranial nerve number 11, which is the accessory nerve, which has to do with the sternocleidomastoid and the trapezius. I'm going to rest my hand here, and I want you to push up. Very good, symmetrical, real good, very good, very good. Right, symmetrical. Your trachea is midline. Okay, I'm going to palpate for the carotid pulse. Pulsation is wonderful. Ooh, bounding, lovely. Okay, I'm going to listen with my stethoscope. I'm going to use the bell. Beautiful. Clear. Okay, good. All right, I'm going to listen to your lungs. Here, I'm going to work my way up. Breathe for me. In, out, in, out, in, out, in, out, in, out. Beautiful. The same thing in the back. I'm going to listen to your lung sound. In, out, in, out, in, out, in, out, in, out. Beautiful. Okay. Now I'm going to ask you to lay back for me. Thank you. I'm going to pull the shirt up a little bit. Yeah. I probably can. Okay. You want to pull this up? Okay, good. Okay. I'm going to listen to quadrant. I'm going to listen for vowel sounds. Good. 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 Very good. So the skin is looking good, the navel is fine, everything looking good, no bruit, no deviation of such. Okay. All right. I'm gonna palpate a little in this quadrant. Right. Good. Any tenderness? Any problem?
No.
Any problem?
No.
Any problem? No. Okay, I'm gonna go a little deeper. Any pain?
No.
Anything?
No.
No tenderness?
No.
Okay. Okay, I'm gonna auscultate the abdomen. Beautiful. Okay, I'm gonna check to find your liver over here, so I'm gonna start to auscultate from here up. Okay. And auscultate down. going to measure in centimeter the span of the, and that is giving me 12 centimeters, and that's normal. Anywhere between 8 to 12 is a normal liver span. Okay. All right. I'm gonna remove these. Okay. I'm gonna try and palpate for the liver. It's good. Over here for the spleen. The kidneys are a little bit difficult to palpate. Okay, all right. I'm going to listen to the renal artery, and in upper right, above the umbilicus, and the left renal artery, upper right, upper left, above the umbilicus, and the iliac, left below the umbilicus, and the right iliac artery, and the right below the umbilicus. Okay, good. Okay, now Mr. Harris, since we do that, I'm also going to let you stay there. I am going to check your knees. Going to palpate your knees. Okay, all right. Stop for a little bit for me. I'm going to check your elbows. Nice. Looking good. Yeah. This is a little deformity here, right? Mm-hmm. Yes, this is where you had the broken arm, right? Mm-hmm. All right, okay. I want you to tell me what's going on if you feel this.
Mm-hmm.
Mm-hmm.
Yes.
Mm-hmm.
Yes. Yes.
Mm-hmm.
Yes.
Mm-hmm.
Yes.
Good. What about that?
Mm-hmm.
Mm-hmm. Mm-hmm.
Yes.
Mm-hmm. Mm-hmm.
Yes.
Mm-hmm.
Yes.
Mm-hmm.
Yes.
Okay, good. Now, I want you to stretch your arm out. Look, I want you to flex, right? Extend. Extension, or the behind. Very good. Hyperextension. Okay, good. Now, I'm going to check your pulse. I have the radial pulse. It's good. The brachial. Do this. Check the reflex. Okay. This one. All right. Here. Check your wrist. Now, what I want you to do, let me check your capillary fill, pink and moist. They're very pink. Take a look. There you go. Yes, less than 2 seconds. Okay. Now, I want you to flex your wrist. I want you to extend your wrist. Okay. I want you to abduct your fingers. Abduct is mean away. Okay. I want you to adduct. Okay. Very good. All right, now I want you to rotate this, keep the hand straight and touch the fingers. Good. Coordination. Very well. Not bad at all. You said any problem, no problem at all with this. You use it very well, right? Okay. All right. Okay. I just want you to step down a little, please. All right. I don't want you to bend over and touch your toe. Okay, come this way. Right there. Bend over and touch your toe. Good. Checking for scoliosis, and also I'm checking for flexion. I want you to raise up and extend all the way back to me. Beautiful, beautiful. Okay, now I want you to turn around, and for the legs, I want you to bend your knees, flex. All right, the other one. Okay, checking your balance there. Okay, I want you to extend them. Out, out. All right, I want you to do the other one. I want you to put it behind you, rotation. Okay, behind the other one. Okay, I want you to do the same with that one.
My name is Michelle. All right.
Very good, very good. Okay, now I want to check your knees. What's going on?
No, we don't have an info, so after she calls me, I'll get the call.
All right, I want you to sit back here. I'm gonna press down and I want you to push up. Strengthen the knee. Very good, very good. Excellent. All right, I'm gonna take off your shoes. Okay, I'm checking your capillary refill. It's good here. Same here. Here, I'm checking the dorsal pedis. Very good, very good. I want you to dorsiflex. Your plantar flex. Plantar flex is down, dorsiflex is up. Both of them. Okay, down. Good. All right. All right. If you don't mind, if you want to step down, I want to check your Achilles tendons over here. Right. I just want you to kneel right here for me. Okay. Good. Very good. All right, sir. If you don't mind, you come back and sit here for me. So now I want to check with you to do the Romberg sign. The Romberg sign is that I want you to come down and stand up like this with your eyes open and keep your hands apart like that. Okay? Okay. Beautiful. Beautiful. All right. So now what I want you to do, keep it like that. Now I want you to close your eyes. Very good. See, no swaying, no nothing. Give sir the balance is very good. Okay. Now, what I want you to do, you can put your hands down. What I want you to do, I want you to walk from over there to over here from the heel to the toe, to me, heel to toe. Okay, turn around and tiptoe. Beautiful. Okay. Made at least. Earlier, I forget to ask you, how tall are you?
5'8.5".
And how much do you weigh, sir?
177 pounds.
Okay. All right. I want you to step down a little. Let me check the spine for you. Okay. Any tenderness?
No.
Yeah. No. Okay. All right. I also would like you to make the twist. Right? Okay. Beautiful. Okay. And also for the leg, I also would like you to extend the leg. Okay. All right. Good. And the other one, I want you to put it behind you.
We did.
We have moved to a quieter place that we don't have to rush what we're doing. I have a few more tests that I need to perform, and I'm going to do it now. Okay? I'm going to do the thyroid gland. I'm going to check for the thyroid gland, and I want you to do that cup in your hand. I want you to sip on it for me. Okay. So go ahead and take a little in your mouth. Hold it in your mouth. Okay. And I'm going to add here. Thyroid right here and on here. So I want you to Flex the neck. Look to the right. Swallow. Beautiful. Okay, take another sip. Okay, flex the neck. And look to the left, swallow. Beautiful. Okay, that was checking for the thyroid glands. Now, I am going to do the Ryan and the Weber's test. And this is to check for lateralization, and also this is a test that will let you know whether you have hearing loss, whether it is conductive or sensorial. Okay? All right. Tell me if you hear it on one side more than the other. Good?
Yeah,
Hear it?
very well.
Okay. Check bone and ear and the ear conduction. Okay. Same thing here. Yeah?
Yes.
Okay.
Yes.
Very good. All right. Now that was to check for hearing loss. Now, that seems to be very good. Now, I am going to talk to you about health promotion on your colon. I understand that you have not had a colonoscopy done, and at the age of 60, I think that you should have had it done at the age of 50. So I am asking you that you would go ahead and make an appointment to see your GI and schedule an appointment to see what's going on, because it's very important, especially for us men, to check on our colon and to make sure that everything is working fantastic. Okay? And thank you, sir. Thank you for your time, and I will see you again.
Okay.